Today is Monday, March 30th, and we are delivering a breaking news update to you from here in Charles County. My name is Jen Harris, and I am the Chief of Media Services and the Designated Public Information Officer for this COVID-19 emergency. We now have 33 confirmed cases here in the county of coronavirus, which is nearly double what we had last Friday. Statewide, there are now 1,413 confirmed cases of COVID-19, which is also nearly double what we had last Friday. Sadly, we must report that over the weekend, we also had our first death related to COVID-19. A man in his 50s from Charles County passed away as a result of complications from COVID-19. I know it's a difficult time for all of us, and we must continue to remain vigilant. In that effort, Governor Hogan just announced this morning a stay-at-home order beginning effective at 8 p.m. tonight. It will require all residents to stay at home except for essential trips to obtain groceries, medicine, or supplies, or to report for an essential job. This is the latest effort to slow down the spread of the coronavirus as the number of cases continues to rapidly rise. I want to talk through this order a little bit, and I'm going to read directly from it to give you a clear understanding of what the governor means by stay at home, because I know that many of you are concerned and are asking. In the order, he says that the stay at home is related to everyone staying home except for obtaining necessary supplies or services for oneself, their family, their household members, their pets or animals, including without limitation. This is important because many of you are probably rushing out to get groceries right now. But it does not put limitation on groceries, other supplies for household consumption or use, supplies and equipment needed to work from home, laundry, and products needed to maintain safety, sanitation, and essential maintenance of the home or residence. Engaging in activities that are essential for the health and safety of oneself, family, household members, pets, or animals, including such things as seeking medical or behavior health or emergency services and obtaining medication or medical supplies. So if you still need to see your healthcare provider, you are permitted to do that. You can also go out to care for a family member, a friend, a pet, or an animal in another household or location, including without limitation, transporting a family member, friend, pet, or livestock animal for essential health and safety activities and to obtain necessary supplies and services. Traveling to and from an educational institution for the purpose of receiving meals or instructional materials for distance learning. And as the weather continues to improve and it's springtime, you can still engage in outdoor exercise activities such as walking, hiking, running, or biking. But please be in compliance with social distancing and do not gather in groups of more than 10 anywhere that you go. We have many parks and recreational assets where people continue to gather in large numbers. There were several hundred reports over the weekend of cases just like that, and I think this is what the governor is trying to address with some of the activities that he's pointing out in this order. So please take this order seriously and don't panic, just be prepared, but we want to delineate exactly what it is you need to know from the order. Also, if you were an essential employee, such as a law enforcement officer or somebody who's complying with a court order, this does not apply to you. Obviously, if you're a healthcare worker engaged in federal, state, or local government activities that require you to report to work, you still are permitted to do so. So I hope this provides clarity. Of course, there will be more information forthcoming, and as soon as we have it, we will share that with all of you. Locally, over the weekend, our hospital is prepared for a surge in patients. They met extensively to plan for that possibility. They've constructed tents outside the hospital that will be used as a triage area. It will include 3 separate tents where patients who need acute care will be sent and then sorted from among patients who need to be screened for respiratory issues. And then third, patients who simply don't have any symptoms related to coronavirus but still need emergency care. So it's really important that you understand what's going on. They do have plans in place to identify additional space if it's needed for a surge in patient care. And you may have also heard the governor mention in his press conference today that a testing site is coming soon to Waldorf. We are aware of that plan, and as soon as we have further details about where it will be, when it will be operated, and who will be allowed to come and get tested, we will certainly share that with you. If you have any other questions about whether or not you need to seek medical treatment for possible COVID-19, you should contact, as always, your personal provider first. And if you don't have one, you may contact the health department through their call center hotline. That number, once again, is 301-609-6717. And of course, if it's an emergency situation, you can call and always should call 911. There are many rumors circulating about COVID-19, and we want to help you separate fact from fiction. Many of you have recently heard that chloroquine phosphate, a chemical that's often used in aquariums, can be used to prevent and treat coronavirus. The CDC says there are no current FDA-approved drugs that can treat COVID-19, so we want to be very clear about that. Currently, medications are being studied and evaluated as treatment for COVID-19. However, their efficacy to either prevent or treat this infection are unknown. Please do not ingest any chemical of this sort. You could be endangering yourself if you do so. We recognize that many of you are small business owners or employees who have lost jobs due to the pandemic and don't know what to do next. Our economic development team has linked up many resources for you to access on its website, CharlesCountyMD.gov. Tomorrow, we will have a detailed update for you on assistance that's being provided. We understand also that many of you are anxious about the spread of COVID-19 in our community and have asked about detailed information regarding possible exposure that has occurred from those who have already tested positive for coronavirus in our community. Your health and safety are our top priorities. Our health department has been doing extensive contact tracing in every single one of these positive cases and has personally notified all those who may be at high risk for exposure. Your risk of exposure is extremely low if you have not had close contact with someone who has tested positive. You can do your part to help us prevent community spread of the virus by following Governor Hogan's order to stay at home except for essential trips and to practice social distancing when you do so. We are committed to stopping the spread, and we will get through this by working together toward that goal. That is the news for today. As we close, I'm including a daily reminder to complete the 2020 census if you have not already done so. Our current response rate is 35.6%, which is slightly ahead of Maryland's response rate of 34.6%. You can complete your form right now by going to my2020census.gov or by calling 844-330-2020. There are many ways to stay informed and connected locally with information about COVID-19 here in Charles County. Follow our website, CharlesCountyMD.gov. Follow us on Facebook or Twitter. Subscribe to the county's daily e-news. Sign up for our text and email alerts through our citizen notification system. And watch CCG-TV on Comcast Channel 95 or Verizon Channel 10. You can also subscribe to the podcast, Charles County Government Unscripted, and listen to my daily updates, or watch us on our YouTube channel, where you currently are receiving these updates every weekday as this public health emergency continues to evolve. Later this afternoon, I will be talking directly to Commissioner President Ruben Collins about what the stay-at-home order means for our community and how you can stay prepared and informed as we move forward. Thank you for listening.